Welcome. This short video will cover Patient Active-Inactive Status, or PAIS, for owning organizations in the Washington State Immunization Information System. Some examples of owning organizations include public and private healthcare clinics and university health centers. This video covers the information in the Managing Patient Ownership and Status Reference Guide found on the Washington IIS Training Portal at www.doh.wa.gov/training-IIS. Patient Active-Inactive Status, or PAIS, is the term used to describe a provider or geographic jurisdiction's responsibility for a patient's immunization status. Only one provider can show active ownership of a patient. When an organization takes ownership of a patient in the IIS, it signifies that this is the person's medical home where they receive the majority of their medical care. Ownership and active status are established when a qualifying event takes place. In iWeb, you will see three patient status options: active, inactive, or deceased. PAIS works differently based upon the organization or facility's ability to own patients in the IIS. Today we are covering how PAIS works for owning organizations. For an organization to automatically take ownership of a patient, a qualifying event must take place. A qualifying event is either an entry of an administered vaccination or a new patient record being added to the system. An owning organization or facility can manually change the patient status to active in the patient demographics page. Changes to a patient's demographic page, such as a new address, does not automatically update the ownership and status. Let's run through a quick example of this. Patient Bobby goes to Apple Clinic to receive a vaccination. Once they document his administered vaccine, his status in the IIS will show as active and owned by Apple Clinic. Now he moves to a different city and is due for another vaccination, so he goes to Banana Clinic, where he receives a vaccination. Once Banana Clinic documents the administered vaccine, Bobby will show as active and owned by Banana Clinic. If a user from Apple Clinic views Bobby's record, it will now show as inactive for Apple Clinic and owned by Banana Clinic. A patient can only be owned by one facility. Patient status can also be managed by using the Manage Population page under the Patient heading in the navigation menu on the left. If necessary, the provider can change the patient status from active to inactive if the patient is no longer seeking medical care. This can assist providers in actively managing their patient populations and improving the accuracy of the reports ran in the IIS. As an owning organization, you can run a report based on your patients that are actively seeking care at your facility as their medical home. Reports can also be run by service. Think of this as a report to identify all patients that have been vaccinated by your facility. Patients can have service records from many providers. If you are running a report by service, ensure that you also select to include inactive patients towards the bottom of the report parameters page. This ensures that all patients will show up on your report if they have been vaccinated at your clinic in the past. For general IIS account help, please contact the help desk. For training and troubleshooting guidance, please reach out to the IIS training team at iis.training@doh.wa.gov. Additional IIS training resources, including quick reference guides and other short training videos, are available on the IIS Training Materials portal at www.doh.wa.gov/training-IIS. You can also visit the IIS YouTube channel for more short videos and previously recorded webinars. Thank you for watching this video on Patient Active-Inactive Status, or PAIS, for owning organizations in the Washington State Immunization Information System.